People who had health insurance just weeks ago are now calling Wichita nonprofits asking for help.
It's part of the ripple effect from the expired Affordable Care Act subsidies. Spencer Hughes shows us how local organizations are responding.
With the expiration of the Affordable Care Act subsidies, organizations like Care and Health say they're already seeing an increase in uninsured patients.
We are already seeing patients today that are already calling us and who had insurance last year and who no longer have insurance this year and asking us for assistance.
Care and Health helps uninsured and low-income patients get prescription medications and glasses. And last year alone, they received $1.6 million in donated medications.
I can only imagine that this year it's going to increase due to how many individuals now are who are uninsured.
Project Access is seeing the same trend. And this organization connects uninsured patients with medical specialists who donate their care. Executive Director Shelley Duncan says referrals jumped 10% just last year, and her small staff is bracing for more.
We actually are a pretty small staff. We only have a total of 9, and we actually have 3 people who do the enrollments.
If demand continues to grow, Duncan says patients may face something they were hoping to avoid.
We would just have to have a waiting list.
In Wichita, Spencer Yu, 12.